Hi guys, so I'm here today to talk to you about your final skills checkoff. I'm going to read through the rubric that Ms. Stewart has posted for you to go through and make sure that we kind of go over the things that she has posted and make it a little bit more clear. I know you all are going to do wonderful, but we'll just start off from the very beginning of the checkoff rubric and move on through. So as we did last time, remembering to just use your eye wipe when you come into the room, like you all did wonderfully the last time. Make sure that you pay attention to doing the two patient identifiers, asking them their name and date of birth, and confirming it with their hospital bracelet that they'll have on. After you've gone through your eye wipe and you've explained your procedure to your patient, what you're going to be assessing them for that day, you will go ahead and obtain vital signs, making sure that you're getting the heart rate and respiratory rate. And then for this skills checkoff, we'll also have you do the blood pressure again, and we'll dual validate you on that one more time. The next one is, so you'll pick one system for the first half of the semester and one system from the second half of the semester. We'll have them separated out in two different piles. So one of your partner will pick one and you'll pick one for the first half, and then same for the second half of the semester. So if one of you guys pick thorax and lungs, we'll make sure to start by asking those two history questions for your patient, and then going through and beginning with your your inspection. So making sure that you're looking at that side-to-side comparison, looking at that AP ratio, inspecting the chest for any use of accessory muscles or respiratory distress that they may be in. And then you'll auscultate those anterior, posterior, and lateral lung fields, making sure that you listen to the 6 areas on the front and then the 8 on the back, making sure you get that right middle lobe. And whenever you're listening to those lung fields, making sure you're identifying the types of sounds that you'll be hearing. So remember the bronchial here, your bronchovesicular, and then your vesicular and the peripheral lung fields. You'll just state your normal findings by saying clear vesicular sounds auscultated in all lung fields, no rales, crackles, or rhonchi, stridor noted, breathing regular with no accessory muscle use noted. After that, we'll ask you guys to do those 3 tests for consolidation that we went over. The bronchophony, when you ask the client to repeat the phase 99, 99, 99 over each of the lung fields, anterior and posterior. The next one is the egophony, where they say E, 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 and the whispered pectoriloquy, where you ask the client to whisper 1, 2, 3, 1, 2, 3, 1, 2, 3. Just making sure you know the abnormals for those. With a bronchophony, you want to hear the muffled 99, 99, 99. The egophony, you should not hear the letter change from E to A. That's the abnormal. And then hearing the actual 1, 2, 3 clear and distinct is the abnormal for that. And that's all for your thorax and lungs assessment. The next one will be your cardiovascular assessment. So knowing again those 2 history questions for your patient, auscultating your carotid arteries using the bell, asking the patient exhale and hold their breath, and then breathing, and then exhaling and hold their breath and listening to the other one. You'll want to palpate each carotid separately as well. And then we will pick the 3 peripheral pulses for you to assess. So either the dorsalis pedis on the top of the foot, the posterior tibialis on the back of the foot behind the ankle bone, your brachial, your carotid, the femoral, and the popliteal. So just like we did last time, making sure you pick those 3. Then we'll ask you guys to palpate the apical impulse and then auscultate the heart. So making sure you're going through and listening to all of those ape to man locations. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And we'll just ask you guys, you can do exactly like you did the last time. You can either tell us where they are or tell us as you're listening what location of the heart that you're assessing. And then your findings will be stated: S1, S2 heard, rate and rhythm regular within normal limits, no extra heart tones, gallops, rubs, murmurs heard. S1 heard loudest at the apex, and S2 heard loudest at the base. While you're listening, you can auscultate for that apical impulse. You'll just need to know to tell us that you would listen for 60 seconds there, looking at your nail beds and your skin color and the capillary refill, noting if there's any clubbing there. And then the last part of that assessment is inspecting and palpating for the peripheral edema. So remember putting your hands on their ankles and squeezing and releasing to see if there's any lasting edema there. You can also push on their tibia bones, like on their shin bone, and check there to see if there's any edema as well. So moving on to our abdominal assessment, asking your 2 questions for this assessment. And like we had talked about, are you having any stomach pain? Have you had any weight loss or weight gain recently that you haven't tried? How is your bowel movement? What is your bowel pattern? So you'll inspect the skin of the abdomen. We will not be asking you guys to lift up your shirts of your partners. You'll just make this up as you go along, stating the normals, making sure you look at the contour of the abdomen to say that the abdomen's flat with no distension noted. You'll auscultate using your diaphragm in all 4 of those quadrants, starting in the right lower quadrant and moving up to the right upper, left upper, and left lower quadrant. Making sure that you state that you hear bowel sounds in all 4 quadrants, and knowing that those are either active, hypoactive, hyperactive, or absent. And you can just state active bowel sounds heard in all 4 quadrants. And we'll maybe ask you, if you hear no bowel sounds, how long do you have to listen before determining that they are actually absent? The blunt percussion will be the next thing that you'll perform, and that's the one where you put your hand on that posterior back and hit with your fist on top of your hand, noting that there is no tenderness there. And then you'll go back through and do the light palpation over the abdomen, and then again with that deep palpation. And the only thing that you'll have to palpate is just the liver. So remembering how we put our hand underneath their back and then up in that quadrant and pushing down as they took a deep breath in, noting that we did not feel any ridges, and that's normal within the normal limits. The last part of that is palpating the aortic pulsations, so just looking at the midline abdomen and making sure that you can kind of feel those pulsations with your fingers, and stating that the normal is 2.5 to 4 centimeters of a pulsation. And again, this one's a little bit different just because we're not actually going to be lifting up the shirts of our partners to kind of let them have some privacy and keeping them to feel comfortable. Then we'll just make this up as we go along. So we'll work with you guys. No worries there. The next exam is our eye exam. It's been a long time since we've done this. So we will, I think, let's see. 1, 2, 3, 4, 5, 6. So I think that this time eyes and head and neck are together in one assessment. Even though that these 2 are separate, you will do these together. So it's still your HHENT. It's just on your rubric and your checkoff form, they are separate, but they'll be combined this time. So going through your, you can start however you want to. If you want to start like you did in the first part of the semester, doing your HHENT all the way through, that's totally fine with us. Just making sure you hit these high points. So I'm just going to go as the rubric follows. And we'll work with you guys there, making sure you hit everything. If there's something that you've missed, we'll make sure to prompt you to say, hey, listen, how do you check for distance vision, or how do you check for such and such? So making sure you know those tests, and we'll help prompt you along the way. But again, let's do starting with your eye exam, asking your 2 questions for HHENT. You can combine those. So have you had any headaches or any issues with your vision lately? Those 2 are great questions you can add in and just keep on going. So knowing how to test your distance visual acuity, so knowing that they would use the Snellen eye chart, stand 20 feet away from that chart, and read the line that they could see the best, and then moving down to make sure you get that good visual acuity in. For patients over 40, looking for that near visual acuity with the Rosenbaum test, having them hold the card 14 inches away from their face and reading. And then the visual fields for peripheral vision is that confrontation test. So having your client stand in front of you, and then that's when we move the fingers in, and they should see it at the same time you did. Or you can do the same thing that we did, holding up the fingers and saying, how many fingers do you see? So 2, 3, doing that kind of thing. 3, 2, 3. I can't count, but going through those. And those will be your 3 tests that you'd have to perform for the eye. The positions test is your cardinal fields of gaze. So going through and having them, you can either do the H. I'm trying to make this smaller so you guys can see it in the video, and looking with just their eyes, or you can do your star that we went through and did as well. Okay. The next one is your perla. So making sure that you see your pupils are equal, round, reactive to light, and accommodation. And so you'll go through with your pen light. Well, I don't have mine. We'll pretend like this is a pen light. So shining at the bridge of the nose to make sure their corneal light reflex is symmetrical, and then coming in from the side and looking at the pupils, and then the next time coming through and looking for that consensual light reflex on the other side. And then your accommodation, asking them to follow the pen light with their eyes only. And then you would just state your findings for those, saying that pupils are equal, round, reactive to light, brisk with accommodation, and they're 4 millimeters bilaterally. Where it says there, if it's brisk or sluggish, you want your reaction to light to be brisk. Sluggish could mean that there's a little bit of something not quite right going on upstairs. Either it's medication induced, or they've had a stroke and have some slowed reactions in their pupillary reflex. So then moving on, just as the rubric follows, inspecting the head, making sure you just say head is normocephalic, no infestations noted. Head movement is voluntary. There is no involuntary movement, meaning like shaking or anything like that. And then just saying the face is symmetrical with appropriate expressions noted. That's all you have to say. You palpate the temporal arteries, making sure there's none of the tenderness, which would be temporal arteritis, and then your temporomandibular joint, like we did, putting your fingers on their jaw. And then for the temporal artery, you literally just have to rub your hands right there on the temples, just making sure there's no tenderness noted. Next, you'll inspect your neck, palpating the thyroid gland. So you can either do that from the front, so putting your hand right there on their thyroid gland, asking them to swallow. Or you can come from behind, like I'll just pretend my hands are coming from behind, and putting your hands there on the thyroid gland and asking them to swallow as well for there. And just noting that there's no enlargement noted at the thyroid gland. The next is that you'll go through your nodes. So your preauricular, postauricular, tonsillar, submandibular, submental, occipital back here, and then your cervical chains. You can just go around the neck for those, and then your supraclavicular and your infraclavicular here. Let's see. And then so at the end, you would just say no lymphadenopathy noted, with no tenderness. And that's all you have to do to get all of those. Make sure I hit all those preauricular. Yeah. Okay. And then that is all that you have to do for your HHENT, which is still a lot, but don't worry. Like we said, we'd prompt you going through. So the last 2 that we'll go through are your musculoskeletal and your neurological assessments. With musculoskeletal, your questions you can ask are you having any chronic back pain or any difficulty with any of your joints lately, any pain, tenderness, and those could just be your 2 assessment questions at the beginning. For history, you could ask your client at first I would ask my client just to walk back and forth in front of you, observing their gait and their posture. And then we'll go through and we will ask you guys 3 of the joints to be able to assess. So remembering that with the hip, you want to make sure that it's symmetrical. And then with your flexion, I don't think I'm going to be able to get up from the desk to show you how to get those and be able to get me in the full picture. But raising each leg, so just taking their leg and sticking it straight out in front of them. And then you can stand back and go all the way back. And that can be your flexion and extension. Extension is going back. The hip flexion is bending up each knee to the chest. So just pulling your knee up to your chest. That's your hip flexion. And then internal and external rotation, so turning your knee in towards the body, turning the knee out away from the body. And then your abduction and adduction, so taking your legs straight, and they'll cross it across the front of their body and out to the side and across to the front. And that's all for your hip. For your shoulder, you'll have the forward flexion and extension. So with the arms at side and elbows extended, move both arms forward. What is it? Oh, just making circles. So you can make your circles here. And then internal, this is external rotation. This is internal rotation, putting the shoulders in. And then abduction here, raising your arms up, and then adduction coming behind your back and putting your arms together. Those are the two that are a little bit the hardest for your shoulders. Your neck, you could just ask them to bend their chin to their chest, and then side to side, and then leaning their neck with the lateral bending. Let's see. Oh, the flexion, the hyperextension from that is your chin to the ceiling. So going back, coming all the way down, looking up, going side to side, and then your lateral bending here. And that gets all of those rotations. Elbows, all you have to do, elbows, flex and extend. That's all you have to do. Just making sure that as they flex and extend, either before or after, you're feeling of those joints to make sure there's no redness or edema. The knee, same thing, just asking them to bend and to extend and contract their legs to be able to look at their knees, and just feeling of their joints as they're doing that, as they're moving their legs. The spine, very, very simple. You just ask them to stand up straight, and then ask them to put their hands together, and then lean all the way forward like they're touching their toes, like they're going to dive off a diving board. And you just look at their back and look for alignment to make sure everything is aligned and symmetrical. The straight leg raise for sciatica. If you want to, you can ask your patient. I'll tell everyone, we're not going to make you lay down and have to do this, but with your straight leg raise, you just ask them to lay down on the bed and then just lift their legs straight up. The lateral bending, so you bend side to side, to bend this way, bend that way. And your hyperextension is just flexing back and then bending all the way forward for that. And rotation, just rotate. And that'll be all you have to do for the spine. Wrist and hand. So if you can bend down, bend up, and then each fingers to the toes. Each finger to the thumb, and making sure that they're able to do that without any pain, or and that each joint is smooth with no tenderness or redness or edema. And then last, for the ankle or foot, rotating the foot around in a circle. I always ask them to draw a circle with their ankle, and then you can ask them to draw the letter A, and that gets really good rotation in, and making sure that they have no issues with that. And then the strength, you can ask them to push their foot down. So like if this is their foot, you ask them to push their foot against your hand for more resistance, like they're pushing on a gas pedal, and then bring their toes up towards their face, and that can get there with the dorsal and the plantar flexion. Dorsal and then plantar. And then as you do those, and so we'll just pick 3 of those that I just went through, and as you do those, you just rate your strength on those joints as well. So 0 being very, very weak to no movement, flaccid, and 5 being the strongest. Whew. So that's that. That's for your musculoskeletal. And then the very last one, we'll go through your neurological assessment. So asking them again, you can say, have you had any headaches, any dizziness, any issues with your memory or cognition lately you want to talk about? Those will be great for your history questions. We're going to choose 3 of the the cranial nerves for you to assess. So like I had mentioned before, if you want to jot those down on a blank piece of paper that you bring in, or if we can have the whiteboards up and you can jot all those down just to kind of help you remember those as you go through. If you pull neuro, that's totally fine with us. So again, the first cranial nerve 1 is the olfactory, so differentiating between smells. So you just ask them to close their eyes, and you can wave the alcohol swab in front of their nose, and noting that they can have their smell since the smell is intact. Number 2, optic. So looking at the visual acuity, so making sure you do your Snellen chart, and then your visual fields, so doing the your oh my gosh, you can do your cardinal fields of gaze with this one. 3, 4, and 6, like we said, they come down. I guess at 2, she has gross confrontation, so that's actually when you do your numbers. But if you did your cardinal fields of gaze as well, that would making sure that they follow and there's no nystagmus and they follow the whole way. 3, 4, and 6, like we said, go together. So if we picked 3, we normally put 3, 4, and 6 together. So doing your perla, so your pupils equal, round, reactive to light, and accommodation. The eyelid elevation, so making sure they raise their eyelids up. And then your EOMs, which are extraocular movements with those 6 cardinal fields of gaze. So that will get you 3, 4, and 6. Your trigeminal, so clenching the teeth. And then asking them if they can feel the movements are equal on both sides. So all I do is just ask them, does this feel the same on both sides? Does this feel the same on both sides? And please don't worry about the corneal light reflex. We can talk about that, but really to be able to truly test the corneal light reflex, you either have to like kind of go like you're going to touch something in their eye, and a lot of times we just do this on patients who are in the ICU, and we'll take a cotton swab and like kind of brush it over their eye if their eyes are open to see if they'll close their eyes. 7 is your facial, so facial expressions, so smile, puff out your cheeks, and then remember when we puff out the cheeks, making sure you can do that against resistance, so then close your eyes really, really tight and open them really, really wide, and show me all your teeth. Jeez. And then your 8 is your acoustic and vestibulocochlear nerve. So the Weber and the Rhine test, and then the whisper test would be what you would do. So remember, the Rhine is when you do your AC, air conduction to bone conduction, and then the Weber whenever you put it on their head. The glossopharyngeal 9 is just asking them to swallow, and then when they open their mouth, saying ah. And so 9 and 10 generally we'll put those together as well, making sure that uvula rises midline. Spinal accessory muscles, so shrugging their shoulders, and you want to shrug them against resistance, and then their head rotation side to side. And then the last one is your hypoglossal, so asking them to stick out their tongue, move it side to side. She has here that you can use the articulation, so ask them to say light, dite, and dynamite to make sure they have that good articulation there as well. And last but not least, we'll do the DTRs, and again, with your deep tendon reflexes, we'll pick 3 for you guys to do. So remember the biceps, hitting here with your biceps are here, sorry. Hitting your thumb right there on that tendon for your biceps, triceps in the back, right? Just above that way, yeah. And then your brachioradialis here, hitting it right there in the upper forearm. And then your patellar right above the kneecap, your Achilles on the back of the foot, and the plantar reflex pulling the light stroke at the sole of the foot. And then last, the Romberg test, so making sure you have your client stand and close their eyes, and you have their hands out around them, not touching them, just around them to make sure that they're not going to fall. And they have good balance, and you can ask them to stand on one foot or hop on one foot. And then the finger to nose test, so taking your finger to nose and moving it as you go through. And then one of the test of rapid alternating movements, so you can just do the fingers to the thumb. And that is all. That's all that's on your Vital Skills Checkoff. And again, this is a lot of information to put through at one time. This is a really big assessment. So if we're going through and checking them off and we realize that you guys have forgotten one part of it, we would just ask you, what's the test that you would use for your neurological exam to check balance? And then you would be like, oh, the Romberg test. And so you would just go through and just perform that, and that would not count off on your check off. We just want to make sure that we help you remember and prompt you if you need that. Now, if we ask you some of these questions and you're like, I have no idea, We kind of go through and maybe have to repeat that one little section for the checkoff, but I know you guys are all going to do a great job, and that's nothing to worry about. But please feel free to call, text, email if you have any questions or anything that I went over doesn't make sense or you need a little bit more clarification on it. We are willing to help you, and we're here if you need anything. But I hope you all have a great afternoon, and we'll talk to you later. Bye.